All right. So we'll have to use sign language because for some reason, as soon as you walk away, you're like, you're gone. Yeah, I can't hear you. So just time out and come up and talk to me if you need to. Jen can translate from up front. Jen, are you staying?
Yeah, I'll be here.
Okay. Yeah, you can just give everybody's questions or something like that as we go. So today, Dr. Gray, thumbs up. We're talking about cancel the cancellations, right? All right. Love it. Love it. So we'll just dive right in. We'll talk about canceling the cancellation and talk about some different things you guys can do. Most of the time, doctors believe that the cancellation is the administrative team member's fault because they happen to be the one answering the phone. And so I argue and say, well, let's just have you up there for a day and you answer the phone. It'll be your fault. And, it's just, look, if someone's calling to cancel, there's a reason why, right? Most commonly heard on the cancellation call is, it's not bothering me. I think I'm going to go ahead and wait. Or so it's yeah, or it could be even a courtesy call. I'm so glad you called. I was just getting ready to call you. You know what? That tooth's not even bothering me. I'm going to wait. Or they'll cancel on the answer machine when they know you're not around. Let me throw this in the answer machine. Just cancel this appointment. They'll say things like, "It's just a cleaning." Okay. So what happens is we've taught people how to treat us. Okay. Now, by we, I mean the medical community altogether. I mean your office. I also mean the chiropractor. The chiropractor says things like, "What works for you?" "Oh yeah, anything. We're flexible. Yeah, you want to come in there? Sure. If it doesn't work for you, you just let us know." So that teaches your patients that anytime they're scheduling with a medical place, if they need to schedule, it's kind of no big deal. They'll put someone else in my slot. They even have a cancellation list. I heard them one time asking me if I could fill one of their openings. Right? And so we communicate in a way that teaches people how to treat us. Right? So we're going to talk about two facets, two different directions today. One is, how do we cancel the cancellation call from even happening? And number two is, if it does happen in the meantime, how do we handle that? Okay, now that would be administrative people. All right, I'm going to pause until, all right, we're back. Am I freezing on you guys? Okay, you're freezing on me. It's not saying I have a bad, yeah, mid-bite there. Just so what we're going to cover two things today. We're going to cover prevention. How do we prevent the cancellation call from even happening? But number two, we're going to also deal with how do we navigate if someone cancels? How do we do that? And so you can replay this for your team members back at home because it'll be on YouTube. Dr. Gray will get you and you can have a team meeting over it. Okay. Make sense? Okay. Any questions, just time out and let me know. Okay. So hygiene typically has the most cancellations in it. Would everybody agree with that? More cancellations on the hygiene side? Yeah, okay. What happens is we hear things like this. It's just a cleaning. Oh, put me down for something in 6 months. If it doesn't work, I'll let you know. There's all these sorts of things that patients say that devalues the hygiene appointment. They've got graduations, they've got weddings, they've got school events, they've got kids to take care of, they got soccer practice, they got all these things, work. And then way down here is this hygiene visit when it comes to priority. Well, we've got to do a better job chair side of improving that priority. So, Dr. Gray, you guys get very many cancel. I mean, people got a toothache. They probably don't typically cancel unless it goes like asymptomatic on them. They go, "Oh no, the antibiotic worked. I'm good now." How many cancellations do you guys typically deal with? More than you what?
More than we like.
More than you like? Okay. All right.
What do you think? 15%? 10 to 15%.
Okay. So
Yeah.
our goal, just for the GPs in the room, our goal is 1% doctor time and 3% doctor time. So you work about 100 hours a month. So 3 hours a month. So about, an hour or about 75 minutes a week, or 45 minutes a week. And then for hygiene, 5% or less. We changed it after COVID. So I was giving you old numbers. So 5%, so about 5 hours per hygienist, about 1.25 per week. And we can hit that target. Now, we'll separate hygiene from doctor. The value of that time, right? 1 hour of hygiene cancellation per day, 1 hour of cancellation per day, 4 days a week. That adds up to about $35,000 a year. So if you consistently get 1 hour of hygiene time open every single day, $35,000 a year. If you have 2 hygienists doing that, $70,000 a year. Okay. Now, doctor, if you had 1 hour a day open 4 days a week for the whole year, it's about $95,000 a year. So if you put those 3 things together, you're talking about $165,000 a year in lost time. That's the value of that. I think there's a statistic shows you waste 10 minutes a day, 1 unit a day, all year long, the whole year. That's like taking 1 week's vacation. So being efficient and scheduling our time is important. Here's the problem. Patients don't know how we schedule. There's 2 reasons why patients cancel. They don't understand or respect our schedule. And 2, they don't have urgency or value to it. That's why the hygienist has higher cancellation rate than the doctor. Doctor has more perceived value to it. So we can tackle both those things. So let's start with urgency and value. We teach people how to treat us. We're going to cut this value of $165,000 in half at least to start with. Let's make $80,000 today. Ready? Here we go. So number 1 with hygienists, it cannot be just a cleaning from our perspective. You have to increase the value of what we do. We call it reason for return, and most hygienists have that in their clinical notes. They've gone to school. They've learned about reason for return. It's something that you document. Okay. So reason for return sounds like this. And Dr. Gray, you don't have to get up. You're just going to nod your head. Okay. You get to be my patient. Okay. So Jerry, Jerry, the patient. So I say, Jerry, as your hygienist, I'm concerned about helping you maintain this level of health. We're taking care of the tartar as you come in every 6 months. We're staying on top of it, but I'm concerned if you were to go beyond that 6 months, what that tartar would turn into, how that would turn into decay, bigger problems, bigger challenges. I'm assuming you want to make sure we stay on top of that and take care of it. Is that right? Okay. So therefore, I'm recommending we see you no more than 6 months from today to stay on top of this. Why don't we go ahead and get that appointment scheduled? Does that sound good? Okay. Yeah, he's a good patient. Okay. So simply pointing out, changing from, why don't we go ahead and get your 6-month appointment scheduled now? Or even worse, saying things like, do you want to schedule your 6-month visit, or do you want to give us a call? Like all this perceived teaching people how to treat us and value of what we do starts to dip. Yeah, it's 6 months to wait for it. I can wait 7 months, 8 months for it. Doesn't matter. And the hygienist is doing super prophies meanwhile at month 8 or month 9. So we've got to be in a place where we instill the urgency chair side as the hygiene team. So reason for returns, number 1. That's a number 1 thing you can do to change the mindset of the patient. Okay. Some of you might be doing something like that. Number 2, that's urgency. Number 2 is how we schedule. We call this, it's a reservation, not an appointment. So I say, don't cough. I say, Jerry, I'm going to be reserving an hour of my time just for you in 6 months so that I can give you my undivided attention. We can give you the highest quality care possible. What we ask in return, and we ask this of all of our patients, is for you to also hold an hour of your time for me in your schedule as well. Does that sound fair to you? Okay. He just nods his head and says yes. So 3 simple steps. I'm reserving an hour. Why? So you get great care from me. I make a request. I want you to do this for me. Okay. So when you take reason for return, urgency, and you take reservation on an appointment, how we schedule, we put those 2 things together, we start seeing fewer calls to cancel appointments. Okay. Now, this is something we've added since COVID. You can say to them how far out you're scheduling. This will really deter people from thinking they can cancel. You say, my schedule right now, our hygiene schedule is booked out about 3 months solid. That means, because by the way, a lot of times patients will say, put me down for something. If it doesn't work, I'll let you know. So you say, my schedule is booked out 3 months solid. So I want to make sure we see every 6 months. If I do that and you cancel your schedule, you might go 8 or 9 months in between appointments. It's really important for us to make sure we get this right the first time. How can we do that? How can we get you scheduled in 6 months and schedule something that you know will work for you? Ask the patient for that. These are things we have to say to educate them on how the schedule is different now. Ask your admin team how frustrated patients are when they find out it's a 3 or 4 month wait to get in for a hygiene appointment when they reschedule. They're like, what are you talking about? They had no idea. Well, they would not have scheduled it so flippantly. They would not have agreed to something that was in conflict of this had they known. So we just preemptively strike it 5 months and 31 days ago and make sure they understand how we schedule this. Does all that make sense, guys? You guys froze for me on a second. Does that make sense? Yeah? Okay. All right. Thanks, Jen. All right. So 3 systems that you can use in prevention: reason for return, reservation, not an appointment, and letting them know how far out you schedule. It's a 3-month wait. Okay. Now, that's for hygiene. Let's set hygiene aside here. Let's talk new patients. Raise your hand if it's frustrating when a new patient doesn't show up. Everybody should be frustrated with that. Okay. Raise your hand if all of your new patients have always shown up. They always show, let's say this year, every single new patient's always shown up. Okay. Raise your hand if maybe 20% of your new patients no show or more, 20% or more. Okay. 10% or less of your new patients no show. Okay. All right. So it's not a huge issue, but it's an issue then. Okay. For those of you who acknowledge this, would you say that you're scheduling new patients further out than a month? Raise your hand if you're scheduling new patients out more than a month right now. Okay. That's good. Are you scheduling? Okay. Some of you. Okay. Are you scheduling new patients more than 2 weeks out? Okay. Yeah. Okay. Now so we're there. All right. And anybody able to get new patients within 7 days, less than 7 days? Okay. This is a popular theme in endo. You have to get them in within 7 days. Okay. Here's why I bring that up. If new patients are not showing, I would risk it and dare say that there's a correlation to how far out they waited versus if they showed up or not. Because I'm on the phone with your administrator and you're putting me out 2 weeks, 3 weeks, 4 weeks, whatever it is, even more. And I go, okay, thank you. I hang up the phone and every night I go to bed, I'm laying in bed thinking, man, I don't have a dental appointment for a while. You know what? I'm going to call around. I'm going to see if there's somewhere else to get in. And I get in somewhere else. They can get me in within 7 days. And I may or may not even call you back. I might even have such a great experience. I've forgotten your name. So they've moved on. It's possible. They feel bad, so they don't do anything. So they just don't show up. They don't realize, they don't know how you schedule. They don't realize you've booked 1 hour to 2 hours of your time for this new patient. And so they just don't do anything. So we've got to do 2 things. One, we've got to get them in within 7 days. Good luck, right? Okay. Or we've got to have a system set aside to help them understand how it's going and what we can do to prevent that no-show. So let's talk about how to prevent the no-show. This doesn't prevent the no-show, but it tells you if they're going to not show up. Okay. So, hi, Jamie. So 7 days before, hi, Cameron, by the way, and 7 days before the appointment, you're going to make a call to the patient called the medical history review call. Okay. So I leave a message for this patient typically, or send a text message. I say, Ricky Bobby, this is Eric calling from Dr. Gray's office. Dr. Gray asked me to give you a call. He has some concerns and some questions about your medical history that I need to review with you before your upcoming appointment so we can be ready. Please call me. It's essential that I talk to you. Please call me today or tomorrow to review your medical history. Now, if a patient doesn't call you back today or tomorrow, what does that tell you about their appointment and them coming in? Probably not a good chance. If they hear that sincere, that serious nature of that phone call and they don't come in, if they don't call you, probably not coming, right? The risk rate is high when someone doesn't return that phone call. However, if they do call you back, you can do a few questions. I'm so glad you called. Dr. Gray had some questions about your medical history. We want to prepare for you. Have you ever had to pre-medicate for a dental appointment before? No, that's great. Have you ever had any joint replacements before? No. All right, that's awesome. And do you have any heart conditions that you're aware of? Right? Okay, awesome. We are set up for your appointment. Not all set. We are completely set up for your appointment in 1 week on Thursday at 3:00. We look forward to seeing you then. Okay. This is a no-brainer that any team can do. So simple to do. You just have to be willing to do it. Any appointment that you schedule 2 weeks or more out, 1 week before you're making this phone call. Very, very simple to do. Now, please don't do something like this, a week before or 5 days before or 3 days before. Don't say this. I'm calling to confirm your appointment. Or even worse, if we don't call us back to confirm your appointment, if we don't hear from you, your appointment's not confirmed, or we're not sure you're coming in, we'll give your appointment to someone. Don't do any of that kind of stuff. Okay. Appointments are confirmed when you schedule it, which we're going to get back to. Appointments are confirmed when you schedule it. So when you leave a message on a confirmation, you leave a message, you say, "Hi, Jen, this is Eric calling from Dr. Gray's office. We have you scheduled in 2 business days, whatever it is, right? So we have you scheduled this Friday at 2:00 with Dr. Gray. We look forward to seeing you then." That's it. There's no phone number. You don't need to call me back. I didn't say call in to confirm, nothing. Why? Because I've done all my work on the front end. Okay, so let's go back to the end of the new patient phone call. Okay. Jen, I'm going to be setting aside an hour and a half of Dr. Gray and his team's time just for you on Friday, September 22nd at 2:00. And all that we ask is that you also hold an hour and a half of your time for us. Does that sound fair to you, Jen? Okay. All right. Thumbs up. Great. Great. You don't have to do much more than that. You're telling them how long they're going to be here. I said, doctor and his team's time just for you. I'm asking you to do something. I'm reserving this much time. It's called reservation, not an appointment. I'm prioritizing the commitment. So these two have been through our online all-star training. We call it setting the expectation, right? Setting the great expectation, prioritizing the commitment. These are phrases that we use, okay? So if you're going to schedule someone, every single time you make sure that you are letting them know how you schedule. If you're a hygienist, you say, I'm reserving an hour of my time just for you. I ask that you also hold that time for me. Does that sound fair? If you're on the phone, you explain how much time you're setting aside of your provider's time, even if it's all with the hygienist. I never tell the patient they're with the hygienist. I say, I'm setting aside an hour of my doctor and team's time just for you. Got to have a mute button here. This cough is killing me. All right. You teach people how to treat you. If you don't say these things, right? Who knows the definition of insanity? What's the definition of insanity? Doing the same thing over and over again, expecting a different result. We keep telling them that we have a policy that we're going to charge them if they don't give us 49 hours or more notice, right? This policy of, hey, we're going to charge you unless you give us 3 days notice. Otherwise, we're fine with it. If you cancel 3 or 4 days or more, we're totally fine with it. Or we have this policy to charge you. That's not going to change anything, right? It's the verbiage you use upon scheduling that changes the result of the patient showing up. Okay. Doctors in the room, all the doctors in the room. One thing that you can really do is emphasize that hygiene visit. You can really, really, really set yourself up for that patient to value the hygiene visit at the end of the operatory visit, or if they're not coming back, you could do it at the exam visit as well. But you could say, let's say it's the end of an appointment. Jamie, you're the assistant. And Jamie and I are talking, and I go, Jamie, next visit for Ricky Bobby. Okay, he's got it scheduled with the hygienist in 3 months. That's perfect. I look at Ricky Bobby, I say, Ricky Bobby, I'm so glad to see that you have that hygiene visit scheduled in 3 months with Virginia. We call her Ginger. Gingivitis. Yeah, that's it. Ginger, the hygienist in 3 months. I'm so glad that you have that set up. In fact, that's the most important visit in our practice. Had you not had that visit with Ginger 3 months ago, and she didn't catch this, what we dealt with today when I came into the exam, this could have turned into a much bigger problem. That's why that appointment's so important. I'm glad to see you have that. That's all you got to say to wrap up. Now they see the doctor, right? The doctor, right? The doctor saying this hygiene visit's the most important visit, and to keep, basically to keep it, to prevent things, they now increase the value of what's happening, perceived value. Okay. Doctors, another thing that you can do for new patients, this is a bit risky. Let's see if anybody's willing to play ball on this one. I could probably get Cameron to do this, actually. So anybody ever, I'm just curious, anybody ever done a doctor new patient phone call? Anybody ever called their new patients before you ever met them, just as the doctor reached out to them and made a phone call? Okay, so this is new territory. We never have a patient come in and go, man, I was going to cancel that appointment, Jen, but Dr. Gray called me, so I'm here. That we don't know how well it works, but what we do see is more new patients raving about the fact that the doctor called. Wow, they check in, they go, wow, I cannot believe Dr. Gray called me. That was really cool. Now you call in the middle of the day when they're at work. You're the doctor, you're busy at lunch. You call one new patient a day for the next day, maybe. You call them up, not emergencies, by the way, not children, adult comprehensive exams. And you just introduce yourself. You just say, hi, Jamie, this is Dr. Vickery calling. And sorry I missed you. I see that we have you scheduled for your first visit in our office tomorrow at 2:00. And I just want to let you know, I'm looking forward to meeting you. Bring all your questions and we'll see how it goes. And I'm just looking forward to, getting started with you. Looking forward to it. Have a great day. Just really simple. Doesn't have to be complicated at all. No phone number. Doesn't replace anything. And I promise you, I've got a couple team members here. If your physician made a call to you, would you guys think that's a wow experience? Or would you think that's depressing and why did they call me? Okay, wow, okay. All right, so thumbs up. All right, this is part of that wow experience. Unreasonable Hospitality is the book, right? Exceeding Expectations. Raving Fans is the book. This is a part of that. So we've been offering this in our coaching for over 20 years, and it's been a real hit for offices that stick to it. But you need your admin team to give you a list of a couple new patients that you're going to see. Please, if you see 10 new patients a day, don't do this, okay? But if you see 1 or 2 new patients a day and they're adult comprehensive exams, you do this the day before and watch what happens. Let's see if the new patient rate increases, okay? New patient show up rate increases. All right. Any questions so far? This is great. You guys are so quiet because you can't talk to me. So I'm just going and going and going and going. I don't have to stop. This has been awesome. All right. Don't hesitate to ask questions. You just got to ask it really loud, probably. All right. Doctors, you have these patients that say, oh, I'm so glad you called. I was totally just getting ready to call you. You know what? That tooth, it's not even hurting me. So I'm going to go ahead and cancel the appointment. Have a great day. Bye. Okay. Anybody know if their admin team hears this? I'm just curious if any doctors have heard this from their admin team before. Okay, nodding of heads. Okay. I promise you, if you portray this to your admin team, they'll finish the sentence for you. And it's a gut punch. Nobody's ever glad that the doctor's office called, by the way. I'm so glad you called. I was just going to call you. No, you're a liar. You forgot. And so what happens is they don't perceive there to be any pain, therefore no problem. So why would they pay? No pain, no problem, no pay. So what we have to help the patient understand is the severity of the condition. So when we teach this, it's called the 95-5 rule. 95% of your communications focused on condition and consequences. Decay leads to toothache, right? If they don't do anything, they're going to end up seeing Dr. Gray, okay? So, and then the 5% is just a treatment talk. So what happens is when we get this cancellation, we have to understand something. The patient didn't believe that this was really a big problem. Let me ask you guys a question. Non-dental human beings, they call your office and they say, how much is a crown? Would you agree that our perception is that someone's recommended a crown, that they're price shopping when they ask that question? Is that the perception? Okay. Okay, no, I see a no and I see some yeses. Okay, the no would be to understand this. The no is accurate. If they're not necessarily, they could be, but they're not necessarily price shopping. What we've actually found is the non-dental human being believes that when there's pain in a tooth, they need to call and get a crown. They have no idea what a root canal is, Dr. Gray. Sorry. But their perception is when there's pain, I call up and say, how much is a crown? What we'd have to figure out on the phone is they're not shopping, actually. They haven't been to the dentist in 2 years, and they've self-diagnosed themselves with a toothache that needs a crown. That's their perception. And we know this because they tell us, yeah, it's not bothering me. I'm going to go ahead and wait. So get your administrative team comfortable with the phone skills. When someone says, yeah, I'm wondering how much a crown is. I don't know. I'm not supposed to talk money. You need to come in for an exam first. That's not what we say. We actually navigate through that conversation. I'm happy to help you out with that. Again, my name is, and who I have the pleasure of speaking with. And when was the last time we saw you in our office? Oh, you're a new patient. Welcome. Well, when was the last time you did see a dentist? Oh, you haven't been to the dentist in 2 years. Well, tell me what's going on with this tooth. Oh, yeah, it just started to bother me off and on about 3 months ago, and then it went away. And now I really need to see someone today. Right? So we have a different understanding now of why people cancel their appointments. No pain, no problem, no pay. So what you have to do chairside is when you're diagnosing the crown, they have to have the understanding of not only what's going on conditionally. It's got fractures. There's a decay underneath an old metal filling that's causing, this sealed condition for decay. It's like a worm inside of an apple, just eating its way on the inside, right? And it hasn't hit the core of the apple, the nerve of the tooth yet, and that's a good thing. So once it hits the core of the apple, once it hits the nerve of the tooth, that's an infected tooth. The only way to solve that, you ever seen an apple core? It just pulls out the core of the apple. That's what this guy over here does, right? He just cores a bunch of apples all day long. Okay, so our goal on the GP side, sorry, Dr. Gray, is to prevent that from happening. Okay, so our goal is to help you prevent the need of what we call a root canal, the removal of the nerve of the tooth. And if we take care of this ahead of time and enough time, we can prevent that. If you wait until it hurts, we can go down that road too, and we can schedule for root canal and then treatment in our office if you like. Either option is good. You just got to let us know what works for you. That will severely decrease the number of calls you get saying it's not bothering me, even for fillings, stuff like that. Okay. So chairside, the 95-5 rule is a cancellation prevention tool. All right. Make sense? I'm speeding through this because there's so many things you can do to help stop cancellations. Did we freeze again? There we are. Okay. Can you still hear me when I'm frozen? Okay, so the audio keeps working, but the video's freezing. Dr. Gray was like this for forever. I was like, man, he's chugging that thing. Okay. So 95-5 rule. Focus on, if you're going to be guilty of selling something in your practice, sell the condition. Sell the diagnosis of what's going on. Let them know the consequence of what's coming if they don't do anything in a very nice way. Okay? Gum disease leads to tooth loss. Cavities lead to toothaches. We're here to prevent those two things from happening. All right. Sound good? All right. Look at it. Nodding heads, thumbs up. Love it. All right. So let's say we do these things. We do all these things. There's so many more things we could do, but for today, we're given a synopsis. But let's say we do all these things and we still get a cancellation call. Or we're getting the calls from what we weren't doing this 5 months and 31 days ago. And so we're getting those calls for canceling hygiene right now. So let's say that happens and we get a cancellation call comes in. We got some things we got to stop saying and some things we got to start saying. So the stop is pretty simple to understand. Robin Reese, my counterpart, the director of hiring at All Star Dental Academy. We do hiring for offices. So if you're looking for hiring and you want that sort of thing, of course, we're there for you. But the number one, when we ask this question, okay, we say we're interviewing for an administrative person. Say, how do you handle a cancellation call? 100% of the time, they think they're saying the right answer to that question. They're not giving us what we're looking for. They always say, oh, I always make sure I get them rescheduled. 100% of the time. When someone cancels, I always make sure I get them rescheduled. What is the goal of a cancellation call, though? What are we really looking to hear there? Can we keep it today? Can we stop the cancellation? So this is the number one first word out of an administrator's mouth when they get a cancellation call. The patient says, yeah, I'm calling to cancel. You know what the number one word they say is? 2 letters. What do they say? Okay. Okay, well, let's find another time that will work for you. Yeah, just those 2 letters. Okay. So what we're suggesting is, instead of the 2 letters, okay, we change it to 1 letter, just O. Oh, well, is everything okay? You know, I want the administrative people to feel like somebody's breaking up with them on the phone. Yeah, it's not working out. It's not working out. Going to need to cancel our date tonight, and I think we've seen enough of each other, right? Okay, well, let's find another time we can go out, right? It's not going to work that way. What you would say, you say, oh, well, is everything okay? Yeah, it's not you, it's me. Okay. So what we're going to do if we get a cancellation call is we're going to say, oh, well, is everything all right? Yeah, something's come up. I got to go ice fishing, probably, right? It's not that season yet, right? Not yet. Okay. Not yet. They're just doing regular fishing right now, but they're not going to tell you that. No, something's come up. Yeah, it's a work thing. Really, really important. Hold on one second while I get your chart. I'm not going to make it easy for them to cancel their appointment in my office. Now, that doesn't mean I'm going to charge them $50 because all that does is piss them off and leave a Google review and they never pay it anyway. So that plays no role anymore. So I get back on the phone and I'm going to share 2 things with them. One is, we talked about it, reason for return. Oh, Ricky Bobby, I can see here with Ginger, the last time you're in, she was concerned about helping you maintain your health. She was concerned about the bleeding on the upper right. She was concerned about the buildup on the lower teeth, on the front side there, the tongue there. She's concerned about that buildup. And that's why she recommended that we see you in exactly 6 months. Now, she doesn't have another available spot for about 3 months from now. I'm concerned that if you go that far out, this is going to become a bigger concern. Are you sure there's any way you can keep this appointment today? I think Dr. Gray said today. That's how his sign language for that, right? Are you sure there's any way you can keep this appointment today? It's not about our policy. It's not about a charge. It's about their well-being and keeping the appointment. Now, I've got an opening tomorrow in Ginger's schedule, but did I talk about that? Nope. It is way out there. My offices, we work with over 100 clients at All-Star Dental Academy. Our clients that have the lowest cancellation rate have the most booked hygiene schedule. So the ones who don't just act like they do. You start teaching people how to treat you. So you say, our next hygiene availability is about 3 months out. Well, you've got a hygienist who's panicking. They don't have a filled schedule. Don't tell them that. Put them in my schedule, right? And an administrator going, I've got to fill a schedule. We'll take care of that in just a second. Okay, we'll still fill the schedule. But you've got to at least give them a chance to say, oh, I don't think I can wait 3 months. Yeah, you know what? I'm going to reschedule the fishing trip and I'll come in tomorrow. Maybe, maybe not. But at least give it a shot to do that. Now, I said there were 2 things we were looking for in their chart. Reason for return was 1. And the second thing we're looking for their chart is, how often have they done this to us? Is this a frequent offender? If this is a frequent offender, at some point, I'm going to have to punt. At some point, I have to give up on this patient. And so if that's the case, if you've put them out several times and they keep rescheduling, then you can give them one of 2 options. I would say, Ricky Bobby, it's been really, really difficult to get you in for this appointment. In fact, we've lost 3 hours of our hygienist scheduled time having to reschedule this appointment. You're a very, very busy person. I think in order for us to continue to move forward and working together and taking care of you, I can give you 2 options. 1, you could show us that you're committed to the time by paying for the appointment in advance. It's $237. Oh, but I have insurance. Yeah, they will reimburse you directly. We just ask that you pay for the appointment in advance, $237 to show us you're committed to it. If you don't, you forfeit that that money. Okay. Or number two, you can call us on a day of basis. You just call us a day you have availability, a day you're not fishing. And if we have availability, we'd be happy to get you in. No guarantees right now because we're booked solid for about 3 months, but we could also do it that way. Which would you prefer? Now, keep in mind, I'm ready to lose this patient at this point. I'm basically firing the patient without firing them. Now, if you want to get rid of them, charge them $400 and get rid of them. That's fine too. Okay. So patient and training list, day of or prepay. They'll either prepay and be a great patient, or they'll call you. And if you have an opening, you're like, sweet, I got someone to fill the schedule. Now, we put this patient out, put them out a month, 2 months, 3 months. Right now, it's been a lot of offices have been 2 to 3 months. Right before I hang up the phone, I've confirmed they're going to come in 2 months now. They say, hey, if you get something sooner, will you give me a call? That's what they always say. I scratch my head and I think to myself, man, this person really wants me to have a bad day. They want more people to cancel. Why would they believe that I'm going to get my next phone call is going to be somebody else canceling, make an opportunity? Why would they believe that? Because the medical profession has taught them this. It's okay to cancel. Everybody does it. We'll get you back in. No worries. Oh, we'll put you on our cancellation list. No, don't do that. So they say, hey, if you get something sooner, will you let me know? I say, well, because we're scheduling so far out, people aren't really rescheduling their appointments. However, let me meet with Ginger. Let me look at her schedule. It sounds like this is important to you. Let me look at her schedule with her. We look at our schedule every single day. And let's see what we can come up with. Hang up the phone. I put them on my cancellation list. I put them on my ASAP list, my quick fill list, whatever you call it. I get a cancellation. Okay, so it's time to call them back. I call Ricky Bobby back and I say, Ricky Bobby, guess what? We had a cancellation tomorrow. No, don't do that. Don't do that. No, all that for nothing, right? We never talk about cancellation. I call them back and I say, Ricky Bobby, you're right. I met with Ginger and she was really concerned that you were scheduled out 2 months. And so she said she'd be willing to see you tomorrow at 2:00 in the afternoon, right in the middle of her day, for an appointment, if you were certain it would work in your schedule. All I'm doing is teaching people how to treat me. I'm retraining them to hear the things I want them to hear. I'm framing it so they hear the things I want them to hear. This came from me sitting in my son's orthodontic office. My daughter now works there. This is great, full story, full circle. But I was sitting in this, and this is different employees were working there at this time. And I was waiting for his appointment. And I was listening to Becky on the phone call household after household after household after household. And she was saying, hi, Mrs. Jones, this is Becky calling from the orthodontist office. Yeah, we have little Bobby scheduled next week. We have an opening in our schedule tomorrow, and I'm wondering if little Bobby wants to come in a week early. No? Okay, we'll see you next week. Call the next household. Yeah, little Ricky, next week, we have an opening tomorrow on our schedule. You want to come in sooner? No? Okay, great. And I started thinking, I was like, man, nobody's taking her up on this offer. All everybody is hearing is they have an opening, they have an opening, they have an opening. And what that's telling me is she was actually planting little future cancellation time bombs. Because that person saying, oh, I know Becky always called me to fill in slots. She must have a list of people she puts in. So it's okay for me to cancel because they'll put someone else in my slot. You get answer machine messages like that. Yeah, this is Bob. I've got an appointment with Ginger at 8 a.m. This morning at 7:30. And I want to give you plenty of notice, let you know I can't come in today. That way you have time to fill my opening. All right, have a great morning. Bye. You get there at 7:35 and you got 25 minutes to fill a slot. They don't know how you schedule. They don't understand it. You've got to have that conversation with them. So when they want to get in sooner, the verbiage we use is willing to see you. Talk to Ginger. She said she'd be willing to see you. I talked with Dr. Gray. He said he'd be willing to see you. Not we had an opening, not we had a change in the schedule, not we had a cancellation. In fact, we don't even say we had previously reserved time that's recently become available. We don't even talk about it, right? It just doesn't exist. We're willing to see you. Does that make sense, guys? Okay. Now, I always want to make sure, Dr. Gray, we have time for some Q&A. I know the microphone thing is going on, but I think if you guys talk loud enough, I could probably hear you if you talk right at the camera. So You're hearing me throw out all these different verbal skill things, systems that we do to stop cancellation. There's no policy. It's all in communication. That's how we get cancellations rate to severely decrease. You're hearing all this. What are your thoughts? What are your challenges? What are your concerns? I'm totally open to that. Or what's a common cancellation you get and you want to know how to handle it? What are some things you guys are dealing with right now in your offices? I'm here to help.
No. Can you hear me?
I can hear you. Yes.
I just want to say, when people call to cancel, you have that opening. What we always say up front to people is, like, Dr. Gray will have an opening. I'll be like, "No, Dr. Gray would like to see you at this time. I know you have appointments scheduled a little later, but he is ready for me and like you to come in earlier." Make it seem like the doctor is requesting for that patient to come in. Shows that, oh my gosh, so the doctor is ready for me. I need to come in. No one has yet turned me down if I use that verbiage. You're
Yeah.
like, oh, sure, I will, it's gonna take me however many minutes to get there, but they're coming in earlier. So at least we have room now below to fill another patient. So it's really creating urgency.
Yeah. So doctor, just for the audio here. So, Dr. Gray asked me to give you a call. He's running ahead of schedule today and said he'd be able to see you sooner, as early as 4:30. How soon can you get here? Right. Just putting it out there. It's not, hey, we had a cancellation. We have an opening or schedule. All that does is hamster wheel it. You perpetually create people who understand it's okay to cancel at their office. They have a whole list of people. That's good, Jamie. All right. What else?
We tell our patients, we're going to work you in, and they call you. That's the end of the discussion, period. And they go. I don't give them a choice, because if they don't go, I'm not seeing them. I told you what to do, go. Life's pretty simple.
Say it looking at the camera again, because I didn't hear. I heard we're going to work you in, but I didn't hear it because you were looking that way. Say it looking this way.
No, when they come here, work you in. So when they call you and tell you to go, period. There's no if, ands, or go.
Yeah.
Be there, be there. That's it.
Yeah, and helping them understand how much time you're setting aside and how you guys operate. Saying things like, we're not a clinic, we're not double booking, we're not running patients through. We're actually setting aside time for every single one of our patients. So we need your help. We need an agreement with all of our patients. Will you please help us out? Will you also hold that same length of time on your schedule for us as well? That's in lieu of, here's our cancellation policy, sign here, we're going to charge you if you don't show up. Those sorts of things. Those things don't work. We've learned that over the years. Good. All right. What else? Any weird cancellations, or you're wondering why things keep happening? Same person keeps canceling, or should I be doing this when they cancel?
Okay, something else. So we, every now and then, you do get the repeat offenders who they're constantly canceling appointments. And before it was kind of a nuisance, we would give them so many times, and then after a certain amount of time, it's like, okay, we're not going to see you back again. You've already wasted so much of our time. But now we've changed it a little bit since we've been working with these guys and exploring other avenues where if somebody's continually canceling, we are having them pay for the appointment ahead of time, because then it shows that they are showing that commitment that they are going to spend the $300 or whatever it is for the evaluation, or if that's what they're coming in for, that they are now committed to that. They have already paid for that appointment, so they kind of.
Yeah, so true, so true. I love the prepay. We talked about insurance freedom last time. I think that's what we talked about, right, Dr. Gray? Insurance freedom. Yeah. So that's a whole nother level of it. But this is a taste of it. If you have someone that you're like, what am I going to lose? They've just wasted 4 hours of my time or 3 hours of my time. I'm not losing anything because they're not even coming as a patient. If they want to be, they've got to prepay. And all of a sudden they become a great patient if they do that. Okay. All right, good stuff. Yes, Cameron.
So I had a repeat offender a lot lately. I just finished their case yesterday, but it's been like a 4-month ordeal doing like crowns and veneers on their front teeth. And they were like a repeat offender of basically late canceling, like day of saying they couldn't come, and all these appointments they're longer. We had to remake some of the stuff. And I saw her so many times that like our rapport is really good, like really cordial with each other. Like it's nice to like see her, and I felt like professionally in the chair it was good. And every time she'd come in times for at least 60 to 90 minutes a time, and I didn't think I handled that situation well, and I'm happy that we finished it, but I like didn't really know what to say other than like, please come back, like we really need to finish this case, like please show up today.
Yeah, I mean, I love that you had good rapport with her. I think that's understanding how you schedule. So at the time, so let's say Jen's my assistant, right? And Cameron's the patient, right? So I say, Jen, for Cameron, I'm going to be blocking 4 hours of my schedule out just for him that day. So it's really, really important that we find a time, Jen, that we know will work for him. So there's no chance of anything interfering with that. Okay. When you guys look at the schedule. And then that second appointment is going to be about 3 hours where we deliver everything. Again, let's make sure any of those about 4 weeks apart. Let's make sure that we know that time works for him. So there's no chance of us having anything interfere with that. We just really can't. This is something we really got to be focused on, and we can't have any sort of cancellations or reschedules on. Okay. So I'm talking to Jen, but who's listening? Yeah, Cameron's right there listening to it, and he's just, we're talking back here, right? And we're at 12 o'clock, and he's sitting there listening, going, okay, all right, that makes sense. And then Jen brings this patient out to Jamie, and we do what's called a transfer of care. We don't say, all right, we're all set. We just need a 4-hour appointment for veneers and then a 2-hour for delivery. All right, have a good day. Bye, Cameron. That's not how we do this. Let's say I'm the assistant bringing this patient out now to Jamie. I say, Jamie, Cameron and doctor both want, not need, both want to get a 4-hour appointment scheduled for the initial phase of the 10 veneers on front. It's really important to doctor that we find a time we know that Cameron can commit to, so there's no chance of anything interfering with this. Right, Cameron? And I go like this, I nod my head, and look what Cameron does when I do that. See? Okay? All right? I don't say, you have any questions for me? All right, you're all set, tap the desk. None of that. It's really on purpose. Everything I say has intentionality to it. There's a reason behind what I say. I never say something on accident. I do, but I try not to. Ask my wife, right? So I'm on purpose what I'm saying. There are things I leave out that I don't say. So no, like I didn't say need, I said wants. Right? There's little things we say psychologically that help my odds. Okay. Let's fix your answering machines, your voicemails. Okay. Raise your hand if your voicemail says something like to the effect of, do not leave any messages in this machine, especially if it's about canceling your appointment. Anybody have anything like that already on their machine? Okay. This is good. All right. In the doctor's voice, perceived power, right? In the doctor's voice, say something on the answer machine like, our hours are Monday through Thursday, 8 to 5. If you've reached this machine during regular hours, please leave a message. We'll be right back with you. If you've reached this message after hours, please do not leave any messages if it's regarding an appointment. Okay? Call us during working hours so we don't play phone tag with you. Okay, we used to say something like, if you're calling regarding a scheduled appointment, please don't leave any messages on the machine. I just kind of got rid of that. So I like just saying, if you're calling regarding anything to do with an appointment or scheduled appointment, please do not leave any messages. Instead, call us back during normal working hours. Okay? Or if this is an emergency, call my endodontist, Dr. Jerry Gray, at, no, I'm just kidding. Give his phone number out. Give him your phone number. Give them your phone number. If this is an emergency, call me at this number. Okay. Now you never answer your phone anyway. So what does it matter? Oh my gosh, the doctor gave me his cell phone number, her cell phone number. They call and leave a message and you listen to it. You're like, I never heard that patient's name before. Tomorrow morning when I get in, I'll have Jen give them a call. Right? Just because they call you doesn't mean you need to answer the phone. So we use this all the time. Patients do not want to call the doctor unless it's a real emergency. It's got to be a real, unless they're a complete knucklehead. Then you're like, you block their number from your phone. Okay. So use something on your answer machine that deters the cancellation. I never forget back when we had answer machines, this is before voicemail, this little lady, she had heard, I just walked in and I heard the beep and she goes, I don't know. It says I can't leave a message on here. I don't know what to do. They just are like talking amongst themselves on the answer machine, and finally she hung up and then later she called back. Look, they're still going to cancel the appointment, but at least I have someone on the phone using, not okay, verbiage to try to save the appointment. If they leave a message on the answer machine, it's canceled. Now I try to reach out to them, I can't get a hold of them. There's a reason why they're calling after hours. Maybe it's legit. Most of the time it's not. They're just trying to get around talking to someone about it. Okay. So you have a few action items with this. Hopefully you guys can watch this recording back with your team, try some new things and see if it starts working. Now, in hygiene, if you start using this verbal skill, how long is it going to take before you start seeing improvement in your hygiene cancellations? Yeah, 6 months. Yeah. So don't use it for a week and go, man, that Eric, he's full of crap, man. This stuff isn't working. It's going to take a while. Okay. So you got to be committed to it. Teach people how to treat you. Sound good? All right. Thumbs up. Love it. Love it. All right. We have a few more minutes. Any more questions? Any more comments? Any suggestions? Anything that you guys have done that's worked really well? I love new ideas. No? Okay. I can't hear.
They say, well, we were looking at that, I mean, not that fixes all hygiene cancellations, but that really lowers.
So I got not that fixes all of them, that really lowers it. What was right before that?
That we're booked out 6 months.
Yes. Oh yeah. The whole, hey, we're booking out that far. Oh my gosh. It's going to really deter. They know when they call, they're like, I know it's going to be forever, So use the willing to see you in combination with that, and you'll drastically see hygiene cancellations go down. 100% agree. Yes. Yes. All right. Awesome. Awesome. All right, Dr. Gray, this has been fun. Now, I know that when I leave these meetings, you guys clear the tables out and get the disco ball out and you start playing the music. I know I missed the fun part, but enjoy it. Have a good evening. And we'll do this again in a couple months. And I think in a couple months, we're doing understanding your KPIs, your key performance indicators. I think that's what we're doing. Something like that. Okay. All right. Awesome. Or case acceptance. I think one or the other. We'll do one or the other. Case acceptance or KPIs. All right. Good to see you guys. Have a good evening. All right. Bye, guys.